Hello and welcome to Chapter 5 in Electronic Health Records. We're going to be talking about scheduling and patient management. If you want to follow along in the textbook, we're going to start on 132. My voice is a little scratchy, so bear with me here. Scheduling appointments is a common task among healthcare staff members, particularly in an ambulatory care setting. An electronic health record system that includes a scheduling feature helps simplify the scheduling and billing processes in a healthcare facility. Using the EHR scheduling feature will decrease the administrative responsibilities of the admissions and front desk staff. The use of an EHR schedule features will help streamline the scheduling process. An EHR system should provide the healthcare facility with a way to schedule patient appointments directly in the system, as you will learn how to do within the EHR Navigator. Some systems will use a separate electronic program to handle scheduling and communicate with the EHR system via a Health Level 7 or HL7 interface. The system scheduling component also includes a messaging system for the healthcare facility, provider, and patient to communicate with each other. Before scheduling any patient visits, however, the facility must set up a facility template showing its overall schedule of operations. Once these scheduling parameters have been set, healthcare staff members can schedule patient appointments in the Schedules tab of the EHR system, and you can see that in Figure 5.1 over on page 133. All right, moving on to the healthcare facility schedule. So let's talk about this. The healthcare facility should create a matrix that shows available and unavailable appointment times. Unavailable times may include meetings, holidays, lunch hours, surgical schedules, physician rounds, or emergencies. The schedule may be viewed as daily, weekly, or monthly calendars, and it may be viewed by patient, provider, or facility. The scheduling tools are used to insert, edit, cancel, or clear an appointment from the schedule. When setting up the EHR system, the acute care or ambulatory care facility enters the parameters for scheduling patients. Typically, a practice administrator or a representative from the healthcare facility works with the EHR vendor to create available days, times, and types of appointments. Such parameters typically include available providers, available scheduling days and hours, and types of visit. A typical EHR schedule for an ambulatory care facility displays a calendar, and this has lists of available providers such as physicians, nurse practitioners, and physician assistants, and a list of open appointments, currently scheduled patients, contact information, types of appointments, and notes. All right, moving over to 134. As mentioned earlier, the EHR scheduling system must block off time for holidays, lunch hours, vacations, personal time, and meetings as necessary. These unavailable hours should be blocked off as soon as possible so patients are not scheduled during those times. Now, in the appointment scheduling process, we're going to drop down. Patients who want to be seen by a healthcare provider or receive care at a facility typically make an appointment for a specified date and time. Most healthcare facilities use a fixed schedule, whereas others, such as urgent care clinics or after-hours clinics, take walk-in appointments. Depending on the appointment type, the length of time will vary, with an office visit usually ranging from 10 minutes to as long as an hour. The healthcare facility typically has each type of appointment set up in the EHR scheduling parameters. Therefore, when an appointment type is selected, the system automatically populates the length of the appointment, but the system will also allow staff members to customize the length of the appointment if necessary. And so if you look over on to page 135, you can see a diagram here about scheduling an outpatient appointment. Now, we talked in our last chapter about how you determine if a patient is new or established, and that criteria was if the patient has not been in that facility within the last 3 years, they're going to be considered a new patient. So when a patient calls, that's the first thing you have to establish. Are they a new patient or are they an established patient? If they are a new patient, then you're going to enter the patient into the system Then you have to determine what kind of appointment do they need. Is it urgent or non-urgent? Now, if it's non-urgent, it says we're going to preferred provider. And if they do have a preferred provider, then we're going to schedule that appointment with that requested provider. If they don't have a preferred provider, then we're going to schedule the earliest non-urgent appointment. Now, if the patient is an urgent patient, then we're going to choose the earliest appointment, and then we're going to schedule that appointment. So be sure to check out that scheduling of an outpatient appointment on page 135. All right, so let's talk about the different scheduling methods. So with our scheduling methods, we're going to talk about 5 of these. So we have several different ways that facilities schedule appointments. No matter the type of scheduling method selected, the schedule must meet the needs of the facility's providers and patients. The type of scheduling methods that may be implemented include open hours, time specified, wave, modified wave, and cluster. So let's talk about open hours first. Patients are seen throughout certain time frames or on a first come, first served basis. This type of scheduling is typically used in your urgent care setting. So you just walk into the clinic, you sign in, and you're put in a queue basically, and first person that comes in is the first one to be seen. Second person to come in is the second person to be seen. So that's how our urgent care clinics work. They use open hours. All right, moving over to 136, we're going to talk about time specified. This is when patients are given a specific date and time to arrive at a facility. A time specified schedule may be used in an acute care settings where patients have a specific date and time for surgery. So time specified, ladies, let's think about OBGYN appointments. Typically they're going to give you a time, but we'll get down in here and you'll also realize that even though you think you might have a time specified appointment because they told you to be there a certain date and certain time, it could be a wave or a modified wave. All right, so getting into wave, patients are scheduled to arrive at the beginning of an hour, hence the term wave, and the number of appointments is determined by dividing the hour by the length of an average visit or procedure. The expectation is that the patient visits will average out the time usage during that hour. This type of scheduling may be used in a primary care office where a group of patients arrive at the top of the hour and then no appointments are scheduled at the bottom of the hour. Then we have our modified wave. Patients arrive at planned intervals in the first half hour, then in the second half hour, the healthcare provider catches up. This type of scheduling may be used in an internal medicine office where the provider does not have to be in the room with the patient for the entire appointment time. So these are just different types where, let's say you have 2 patients scheduled at 9 a.m. and 2 patients scheduled at 9:15 and 2 patients scheduled at 9:30. And then they use the rest of that half hour, 9:45 up until 10, they use that to get caught up on those 6 patients that they scheduled that first 30 minutes. Then we have our cluster. This is similar appointments are scheduled together at specific times of the day. This is where our pediatric visits come in. So let's say they use well child visits in the morning. So they schedule all their well child visits and then they schedule their ill child appointments for after lunch. So that's how you would do a cluster. You're going to group similar type patients together. All right, let's move over and talk about patient appointment scheduling on 137. Once the facility schedule includes the necessary parameters, patient appointments may be scheduled. There are a few ways to schedule an appointment in the EHR scheduling system. A patient can schedule an appointment through a secure patient portal, which gives the patient the opportunity to request his or her preferred appointment. Or more traditionally, patients contact the healthcare facility to schedule their appointment. Now, what information is needed when you are scheduling an appointment? First of all, there's a list on 137. I'm not going to read through all of these, and you can see more information in this slide. But of course, they need the patient's name. They're going to need their date of birth. If you've called and made yourself an appointment, they're going to ask, well, what's wrong? Why are you coming in to see us today? So the chief complaint or the reason for your appointment. They may ask for your insurance information over the phone. They're going to get your address. etc. Now, if you're walking in, they may get all of that more detailed information if you've never been there before. So, using the Master Patient Index, the healthcare facility may populate the admission or appointment for an established patient by collecting the following information. Now, again, new patients, they're going to have much more information gathered. Our established patient, we only have 4 things listed: your full name, your date of birth, your telephone number, and the chief complaint. Why are you coming in? All right, dropping down to the bottom of 137. Many EHR systems contain either a patient portal or a personal health record component. The patient portal provides a secure communication tool between patients and healthcare providers that complies with the HIPAA Act. Patient portals can also provide patients with information for their PHRs. Some patient portals are web-based and provide 24-hour self-service components for patients to use. The patient portal links to the facility's EHR system and allows the patient to view a provider's calendar for available dates and times and allows them to schedule an appointment. The patient portal scheduling component is used only by established patients of the acute care or ambulatory care facility. So if you're a brand new patient, you've never been there before, then you're not going to have a portal. You can't log in because, again, you're not established. You have to be an established patient to go into a portal and make your own appointment. Now, the healthcare provider gives an established patient an access code that allows him or her to schedule an appointment, send a message, update information, view lab appointments, request for prescription refills, update and view his or her health record. The patient accesses the patient portal by entering a username and a password. Once logged in, the patient can view upcoming appointments, schedule appointments, view past appointments, and request referrals. All right, moving over to 139. The patient portal makes scheduling convenient for the patient and healthcare facility. Practices that implement a patient portal provide value to the patient by increasing patient access, enhancing the relationship between patients and providers, improving quality of care, and securing information. And your patient portal also meets 4 meaningful use criteria. Now, it is the patient engagement criteria 1, 2, 3, and 4. First one is electronic copy of health information. 2, clinical summaries. 3, appointment recalls. And 4, timely access to health information. All right, moving over to 140, we're continuing on with scheduling that appointment. So when a patient telephones the healthcare facility or is present to schedule an appointment, there's 2 ways to do this. First, you either go to Schedules, and this method is the easiest way to schedule an appointment. It allows the user to see the available time slots in facility areas at a glance. And you can see this in figure 5.8 on page 140. Your second option is to select Appointment List and then add appointment. This method allows the user to modify the traditional appointment times, but both methods produce the same result, an appointment. All right, what happens when we need to cancel an appointment? Many facilities struggle with patients who cancel appointments or those who do not show for their scheduled appointments. These are called no-shows. Patients cancel their appointments for a variety of reasons, including scheduling conflicts, emotional issues, financial concerns, and for no-shows, forgetfulness. Regardless of the reason, each facility must set its own policy on cancellation fees, and each canceled appointment or no-show should be documented in the EHR system. Tracking these types of appointments will enable the healthcare facility to run reports and determine its rate of no-shows. Confirming appointments decreases the incidences of no-shows, which in turn increases practice productivity and revenue. That's really where it comes in for your forgetful patients. I don't know how many of you receive text notifications that you have an appointment coming up and you need to reply with a C to confirm, or you get an automated phone call reminding you of an appointment time. So that's what they're meaning when they say that confirming appointments decreases the incidence of no-shows, especially those forgetful patients. Healthcare staff can decrease the number of no-shows by setting up automated confirmation of appointments in the EHR system. To maximize the results of confirming appointments, patients can be given the options to receive a phone call, text message, or secure email reminder based on personal preference. Rescheduling may be the outcome of a canceled or a no-show appointment. All right, we're skipping over to page 143. We're going to talk about patient transfers within the EHR system. So while receiving care in a hospital, a patient may need to be transferred from one unit or room to another. Some of the reasons for a patient transfer include a change in patient condition, change in isolation status, or patient preference. So we're going to talk about all three of these. So during an inpatient stay, a patient's condition may improve or deteriorate to the point that he or she must be transferred to a nursing unit in the hospital that can more adequately address his or her needs. For example, a patient in a room on a postoperative hospital unit who experiences cardiac arrest will likely be transferred to a more intensive nursing unit such as cardiac intensive care. As the patient stabilizes and improves, they may be moved to a less intensive care unit. So that's where you have patient condition changes. If you're in the intensive care and you start getting better, then they're going to move you out. If you're on the normal unit and you start deteriorating, then they are going to move you back to intensive care. So that's our change in patient condition transfers. Isolation status refers to the precautions that must be taken by healthcare staff and visitors to prevent the spread of bacterial or viral infections. Many hospital rooms are semi-private, meaning that there are two patients occupying a room. Patients can be admitted to the same room only if they have the same isolation status. For example, a patient with MRSA cannot be admitted to the room of a patient without the same infection, as there is a substantial risk that the other patient may become infected with MRSA. And so, MRSA, tuberculosis, any other transfer contact precautions, things like that, they're not going to put a relatively healthy patient in a room with a patient that has MRSA or TB. That's just how it works. Then we have patient preference. Some patients just aren't happy with their room. Maybe it's too loud or they don't like their roommate. And so you could have a transfer for that reason as well. All right, so let's talk about our checkout and discharge procedures. The procedure for a patient leaving a medical facility varies depending on whether they're checking out at an outpatient facility or being discharged from an inpatient facility. Following an outpatient visit, the patient will check out. The checkout procedure may include collecting payments, ordering tests, making referrals, or scheduling a future appointment for the patient. During the checkout process, all of the necessary prescriptions and completed forms must be verified. The discharge of an inpatient from an acute care hospital is entered into the EHR Navigator via the Admission Discharge tab. The date and time of the patient's discharge are automatically captured when the nurse or staff member enters the discharge into the EHR system. The discharge disposition, or the patient's destination following a stay in the hospital, is also entered. Examples of discharge disposition include home, skilled nursing facility, rehabilitation hospital, and long-term acute care hospital. If an inpatient dies, the discharge disposition is entered as expired. Discharge documents may be generated from the EHR system. These documents may include discharge instructions specific to the patient's diagnosis and procedures performed. All right, let's get into electronic patient trackers. An EHR system has the ability to track a patient's location from admission to discharge for inpatients or from check-in to check-out for outpatients. This feature offers a real-time, at-a-glance view of a patient's current status and location. Electronic patient tracking, or EPT, is an important function of an EHR system. EPT tracks a patient's location from the time of his or her arrival at the healthcare organization to discharge for our inpatients and checkout for outpatients. The EPT function offers a real-time, at-a-glance view of a patient's current status and location. The electronic patient tracking replaces the traditional use of a whiteboard. Knowing the location and status of all patients at all times is the obvious benefit of the EPT system. Other benefits include real-time monitoring of patient wait times and bottlenecks in the flow of patient care, room and provider utilization statistics for analysis, and identification of opportunities for improvement in patient flow and care. Improving the flow of patients with the use of EPT results in operational cost savings for the healthcare organization and increased patient satisfaction because of a reduction in wait times. Now, they are either simple or complex as far as the patient trackers go. Electronic patient tracking, at its simplest, is an outpatient checking in for a scheduled appointment. The staff member indicates the patient's arrival in the system, and the medical assistant enters the patient's location as the patient is taken back to the exam room, and then a staff member enters the patient departure at the time of checkout. To locate a patient, a staff member has to access one of the office's computers. So that's your simple. It's a person actually doing the entry into the system of when that patient's location changes. The more complex EPT functionality might have patients check in via a kiosk. The kiosk prints a wristband that contains a computer chip that tracks the patient via the organization's secure wireless internet. Authorized users of the healthcare organization can determine a patient's location via the organization's computers and their authorized mobile devices. Consider the time savings for providers and staff who are able to quickly determine whether a patient is in his or her hospital room, CT scanning rooms, surgery, or somewhere else. All right, that's really going to cover our chapter 5, patient and scheduling. So I'm going to talk about the chapter summary here over on 147. So scheduling patients in an acute care ambulatory care facility is a key factor in the delivery of health care. Scheduling depends on the type of facility and the type of appointment. In an acute care facility, the appointment depends on resources, such as the availability of the healthcare provider and or the equipment and the type of procedure ordered. Ambulatory care patients are typically labeled as new or established. When scheduling a new patient, healthcare staff must gather demographic and financial information. There are 5 scheduling methods, each designed to meet the specific needs of the facility. The scheduling methods include open hours, time specified, wave, modified wave, and cluster. The electronic health record system provides features for scheduling, canceling, and rescheduling appointments. An EHR system must display a schedule of patient appointments and generate reports of clinical and administrative information. Transferring patients may be necessary because the patient's condition or isolation status changes, or because he or she is dissatisfied with the room. And finally, tracking patients allows facilities to know immediately the location and status of a patient, increasing workflow efficiency and patient satisfaction. So, again, read through this entire chapter, be familiar. Again, you're going to have assessments to complete. And then, of course, your quiz within EHR Navigator as well. So, good luck and happy study.